Welcome to the LMD Podiatry Podcast. Trust us to get back on your feet. Here's your host, Dr. Lauren Dabakaroff.
Well, hello everyone, and welcome back to another episode of the LMD Podiatry Podcast. Your co-host, Jeremy Wolf, alongside none other than the hostess with the mostest, Dr. Lauren Dabakaroff. Always a pleasure to see you.
Thank you, Jeremy. Always a pleasure to hang out with you and talk about feet.
Talk about the feet. Yeah, I read somewhere recently that a staggering number, around 80% of Americans at some point or other in their life suffer from foot pain, in many cases chronic foot pain, right? And it makes sense, right? Because we're on our feet all day. So today we're going to talk a little bit about that. We're going to talk about what constitutes chronic foot pain, why it's so prevalent across our population, how we treat it, how we manage it, and I think more importantly, how we can prevent it from happening in the first place. So
all right,
we're going to get into this. I'm going to pick your brain. You are the expert here. I got some good questions for you. So let's just start off from like definitionally speaking, right? Like what in your mind or what constitutes chronic foot pain?
So in my mind, chronic foot pain is essentially pain that doesn't go away, right? If someone has pain every day, whether it's with a specific step or with a specific shoe or a specific movement that they do, that is the definition of chronic foot pain. It's just daily and it doesn't really resolve on its own. So now there's multiple factors that go into that, but that's my definition. If someone has this nagging pain and doesn't go away, and then if they do something about it and it still doesn't go away, then it's officially chronic.
Got it. So, and I mentioned that number, 80% of Americans. I wasn't sure if that was just foot pain, generally speaking, or actually chronic foot pain. How common is it, from what you see in your practice, how common is chronic foot pain, and who do you tend to see that deals with it most? Is it mostly the elder population? Is it like who's your prime suspect, if you will, for this ailment?
I mean, okay, so I see a lot of patients. I'm going to say it's very common in the inactive people and people with multiple medical issues, also in the obese population. And there are athletes with chronic foot pain as well, but that's from like some type of injury or something like that didn't heal. But the people that always have pain in their legs and their feet and their ankles, and it's always both of them, and it's always just the pain doesn't go away, and they've tried it all. I find it a lot in those people who are very inactive, very immobile, obese as well. I see that a lot. And then there is, like, I just had a patient today who had a chronic foot pain, and he tried everything, and I finally got an MRI, and he had a tear in his foot, right? So he's had chronic foot pain. He's been suffering for 3 years, and me finally got an MRI. And so it's a matter. So he's been trying to live with it for a very, very long time. But in his case, there's a solution. We're going to try X, Y, and Z to get his tear to heal, but there's always a reason behind it. And he decided not to ignore it anymore because he's an athlete.
Smart man. Glad he has you in his corner to help him through that process.
Right.
So I want to speak to a lot of people out there. I think there's a lot of people that experience some pain in their feet from time to time, and just ignore it.
Right.
In your practice, what are some of the biggest mistakes that people typically make when they first start feeling foot pain? Because I know from where I sit, I'm in pain. I'm often in pain, right? I run a lot, as you know, and a lot of times I have to kind of weigh in my head, is this just a pain that is not a big deal, or is it a bigger problem? Is there an actual injury underneath it? And there's like a line between there. How do you see that from your lens?
So if it's a pain that you can't walk it off and it keeps coming back, you need to see a doctor for that. Some of the telltale signs of chronic foot pain would be like pain with the first step in the morning. Every time you wake up in the middle of the night to go to the bathroom or put your foot down in the morning, and your foot or your ankle or your leg is excruciating, something's going on. Okay. Or a lot of times when you have pain at the end of the day, meaning you had a normal day, you went to work, you went to Publix, you walked
And
around.
your feet are aching, and
Huh?
you want to get off your feet. Your feet are aching,
You
and
want to
you're
get off, they're burning and they're achy. At the end of the day, something's going on. So so the reason why I wanted to bring up chronic pain, it's not necessarily if there's like an acute injury per se. I wanted to more discuss about how to get people out of the pain cycle. But like, for example, the telltale signs would be like burning feet, tired feet, and the most common mistake is the person's shoe. Like I said, you have an obese population in America, and then they're wearing these thin-soled shoes that are not giving them any support. Not that I'm against barefoot walking. I'm not. There's this whole like there's this whole trend. I don't know if I want to call it a trend, but there's this whole ideology of strengthening all the intrinsic muscles of your foot to heal your foot and things like that. And that's great if you weren't obese, right? There's the zero drop shoes and toe yoga and things like that. I'm not against it. I was not educated about it in school. It can help with a lot of people's foot pains, but for people who have constant pain and they have like burning and numbness and tingling and achy feet and it just doesn't go away,
that's support.
Yeah. So that's where I would categorize it as chronic foot pain, right?
Okay.
And a lot of people suffer from it. Even I do. I had issues with my feet for a while, and until I changed my shoes and did some therapy and put in some orthotics, now my foot pain's gone. And when I wear the wrong shoe and I had a nice Thanksgiving and I gained 3 pounds, I feel it, So is it, my foot pain is not necessarily chronic, but I know what instigates it. I know what is gonna trigger it. I know what my foot needs, right? Because I'm not light, I'm not obese, but I'm not light. And my foot doesn't like a thin sole shoe, and I can tell. I could feel it when I wear a flip flop.
Yeah, that makes perfect sense. Obviously, if you're suffering from obesity, putting more strain, like walking around barefoot, is going to put. Yeah, while it might help for somebody like maybe. I've heard that like beach running is good for me, like on the sand, because your feet go in all different ways and you're stressing all the different muscles. But if you already have a significant excess load, I could see how that could create stressors. So the first thing would be, foundation. Obviously, it speaks to a larger issue, right, about like overall health and trying to maintain a healthy lifestyle. A lot of these ailments that people suffer from, not just chronic foot pain, but all sorts of chronic pain, can in many times be addressed by like lifestyle changes, right? Changes of your diet, changes of exercise, your overall well-being, in many cases will solve these types of issues. And I know you mentioned that before we started. A lot of times this chronic pain is really in people's heads, right? It's psychosomatic to some degree.
A lot of times, like, listen, there's people with fibromyalgia and depression, and that also takes a big number. It does play a big factor in their foot pain. Like, I had a patient who he had a fracture for like a year, and someone just put him in a boot for like way too long, and he had complete disuse of his foot, and he was in so much pain. I fixed his foot surgically. I fixed everything. I did all these therapies on him. I touch his foot, it doesn't hurt, but he says my foot hurts. We repeated MRIs, and everyone's telling him there's nothing wrong with his foot. And then the second I recommended like a lifestyle coach to him, who got him on like a better diet, on an exercise routine, and we both made him walk through his pain. He snapped out of it, and now his foot doesn't hurt because he's happier now. And it's just like he had something. I think he also did a little bit of neurofeedback therapy. That's like for people with attention deficit disorder. Sometimes there's just synapses in your brain that don't click, and you really need to think outside the box. And that's when I love to like call upon the chiropractors and the lifestyle coaches. And there's even something cool called MRI therapy, which is like reflex therapy. Very interesting stuff. And it's all about training the body to snap out of this pain that they're stuck in. So yes, the foot can have a physical injury, but sometimes the pain doesn't let because something is going on in the subconscious. Something is going on
Hmm.
on a different level in the brain. And sometimes they're so depressed about their pain that it doesn't release. Right. So there's all those things are very connected to chronic foot pain, which is why I love my multi-step approach. If the physical is there, and even after we address the physical chronic issue, like let's say if the injury is healed, if the fracture is healed, if the chronic plantar fasciitis is healed, if the chronic tendonitis is healed, but they still have pain, there's something else neurologically
Yep.
uh, or subconsciously affecting them. And even health wise, a lot of people, they have injuries. Your body should heal almost everything
Naturally.
naturally,
Yep.
but sometimes, like, we live in a society that has bad nutrition, so your body cannot detoxify, you cannot heal things properly. Like, you probably are a lot healthier than me. Let's say you take more vitamins, so if you sprain your ankle, you'll heal it faster than me, right? So those all things, they play factors. That's why when I have patients with chronic issues, I address all that. I put them on vitamins, I send them to a lifestyle coach, I tell them to decrease their carbs, I send them to a chiropractor who does specialized like techniques to release things from up here, because a lot of times there's things that happen up here or higher up in the leg or the hip that's affecting the pain down in the foot. So that's kind
Absolutely.
of like, that's why I wanted to bring this topic to the forefront, because people are suffering and they're ignoring it, and they shouldn't, because it could affect their health, it could affect their emotions, it could affect their psyche. And then what kind of life do you want to live full of pain? There's
Yeah.
lots of there's just it's just so multifaceted. Even me, I had this tendonitis in my foot and it wouldn't go away, and I didn't know why. And I went to like a couple of different people who were like outside of the box than your traditional doctors, and they were like, "You have chronic anxiety and stress, and because of that, I keep like tightening up one side of my body, and it's compensating down there."
Yep.
I was like, "Stop it." I was like, "No, no."
Fascinating.
I was like, "No." First, I didn't believe it, but then I did some chiropractics, I did some like changes, I did some stretches, and it made a difference. I was like, wow. And then I was like, I need to take care of myself. I need to take calming baths, and I need to stretch a little more and take more walks, and be there for myself. So all these things, there's all this subconscious and emotional things that are related to chronic pain anywhere in your body. But in general, foot pain, number one, is always shoe related and obesity related in our generation, and that's where it starts. What do you
Yeah.
think, Jeremy?
What was that?
What are you thinking?
No, I'm fascinated by, you're hearing a little echo. No, I think we're good now. The psychosomatic side of this, because I notice, thankfully, I don't have, even as a runner, I don't really have chronic foot pain. My feet are sore from time to time, but I typically get more pain in my knees from the running and my lower back. But I'll find myself running sometimes, and like I'm perfectly fine, and then I get close to the end and I feel like I want to stop, and then all of a sudden I'll get like a little pain in my knee, and I start thinking in my mind, oh wow, am I about to hurt something, or is this just my body trying to like hijack me to stop running? And I'm like, and then all of a sudden the other knee will start hurting out of nowhere, and it's like, okay, it's not the knee now, it's just in my head. But there is a fine line between having a full-blown injury and actually just having something going on in your mind. So when a patient does show up in your office that's experiencing this kind of pain, like take us through. Somebody's out there, let's say I have chronic foot pain. I pop into your office. What is that process? What does the evaluation process look like? Like, walk us through what we're to expect when we come in the office with this issue.
Right. So let's say someone comes in with foot pain. They've had it for a year, and they've gone to doctors, tried this, tried that, doesn't go away. So my first approach is always to take the X-ray, because you want to take a look at the bones. I don't just check for a fracture or something like that. I actually look at the shape of the patient's foot, because the shape of the foot tells a lot about how they walk. Okay. And if